Hello, my dear friends, dear candidates, DNB aspirants, and my dear students. So last time I came with a video that was a DNB and YOU, and in this video I have explained that a lot of difference between MDMS and DNB and what is the present scenario in our country about the Diplomate of National Board. I have got the inputs. Few people have asked me to record this video in English, so it's the part 2. I am bringing it in English so that it goes to more and more number of candidates. Okay, fine. In this video I will just like to repeat few of my points which I have discussed in my last video. Is that earlier people used to choose DNB only when they were not able to find seat in MDMS, but now today the scenario has totally changed. Now people choose DNB or MDMS if they don't find branch of their choice in MDMS, and moreover in most of the MDMS seats, if you go, you have to fill up the bond of 2 to 3 years, which is this condition is not there in the Diplomate of National Board. Then I have discussed about the equivalence. If you are going to the in the private practice, there is absolutely no difference between MDMS and DNB. Both are equally same. But if you want to teach in the medical college, the government or the board of governors have laid down certain conditions. Unless until you fulfill that condition, you are not eligible to teach or to become assistant professor in the medical college. Now, just will revise those conditions. One is they have divided this on the number of beds. If you have done your DNB from the medical college, or you have done your DNB from the institute, which is more than 500 bedded, and the two of the PG teachers have qualification and requirements of the PG teachers as per the MCI guidelines, then you need not do any extra year of senior residency. You just have to do 1 year of senior residency, which is also required by MDMS candidate. Now the second, if you have done your DNB from the institute which is between 100 to 500 bed, or more than 500 bed where the PG criteria is not fulfilled, then you have to do 1 extra year of senior residency. This means total 2 years of senior residency you have to do. And third is the criteria, those who have done DNB from the less than 100 bedded hospital, then these people are required to do 2 extra years of senior residency from the government recognized medical colleges. So total 3 years of senior residency they will have to do to become eligible for the post of assistant professor. So all these things I have discussed in my last video, and I have told you the very easy way of passing your exams. Today I will just talk about nowadays counseling is going on. A lot of people have got seats in DNB. Mop up around is near. More and more number of people will be choosing DNB. Now today what I will talk is after you take DNB seat. So here I will discuss that once you have opted, or you have chosen some seat in one of the institute of DNB, then what next? What you are supposed to do next? The first and foremost thing that you are supposed to do is just try to draw the brain. Now, till now, two things were moving in your brain is DNB and MDMS. Some of you must be trying to get MDMS seat, but they got DNB seat. Some of you had a preference of DNB seat, and they must have got DNB seat. The first thing you should do is, after you have got the DNB seat, is erase this term MDMS from your mind. Now during your course, this term MDMS should not come in your mind. You have taken seat in DNB, just concentrate on your degree, and this is a well acclaimed degree in India, and it is also internationally acclaimed, and it is one of the recognized degree, and you should be proud of to doing Diplomate of National Board. Might be in between for those people who had an option to take MDMS, but because of few reasons they are not able to get DNB. This thing will keep on banging their mind that they have not got MDMS seat. The first thing what I will tell you, my dear friends, just remove this word MDMS from your mind for the next 3 years, since till you are doing your DNB. Now this DNB of Diplomate of National Board, after 3 years you will get a degree from National Board of Examination, and this is one of the highly respected degree in India and internationally. So there is nothing to be offended in any way. You are getting a very good degree, very respectable degree, and you should be proud of getting this degree. So after you have I am not saying that all of you will get institute of your choice, but now once you have taken DNB seat and the institute had been allotted to you, now your game starts. Game of sincerity, game of full dedication, game of hard work. This thing start, because finally you are going to get DNB degree, and getting DNB degree is much more tougher than getting MDMS degree, and this is well known fact. Both degrees have got their different merits and demerits. So we'll discuss about the merits and demerits of doing DNB. But first thing, I will advise you that remove this term MDMS from your mind. Now, once you have taken your DNB seat, and the seat had been allotted to you in some of the institute, the first few days you will take to just be familiar with your department, be familiar with your teachers, be familiar with your surrounding. Just try to find out what is the patient load, just try to find out what is the teaching. And there I will tell you, there are all type of students present either in the medical college or in the private institute. So it is not all the time that the institute has to be blamed. It is many times you find if the person or candidate has also to be blamed if the candidate is not performing well. It's same like in your school days, having a same teacher, some of the candidates, some of the students will achieve more than 98% marks, or some will achieve 60 to 70% marks. So there is no way of the fault of the teacher. He is delivering his lecture, he is giving his best to and equal to all of the candidates, but few candidates get more marks, few get less. So your sincerity, dedication and hard work now starts. You have to give your 100% if you want to clear your DNB in very first attempt. Because I have already told you in your last video that after you clear your 3 years, or you successfully complete your 3 years, you will have to appear for your theory examination. And if you pass your theory in the first attempt, then you will be given a chance to appear for the practical 3 times. First practical, it is mandatory for you to appear along with your first theory result, but next 2 attempts you can give in 3 consecutive practical examinations. So 3 consecutive means 1.5 years you can take to appear for next 2 practical examinations. And if you are not able to clear all the 3 practical examinations, then you will have to appear for theory again, which is one of the very difficult part in the DNB, because in the duration of 2 years you forget so many things, because you have adjusted yourself and you had been preparing more in the practical mode, and your theory mode had been silent. So it will be a bit difficult for you to restart everything, and in meanwhile so many recent advances will become that will cause you some type of difficulties in passing the examination. So you should try to pass the examination in the very first attempt. Now I will tell you what exactly you should do if you want to pass your examination in the very first attempt. Now few things that are required in DNB, that within 90 days you have to submit your protocol of your thesis. Now don't forget this deadline, and within 90 days you will be, as soon as you join, within few days or a few weeks you will be allotted guide, and the guide will help you finding out the topic of your thesis. Try to get the topic which you think you can work on easily, and in coordination with your guide, take help of him and prepare protocol of your thesis. This has to be done within 90 days of your joining the DNB. Now, during your DNB course, have a better tuning, a better understanding with your teachers and with your guide, and have a very good, try to have a very good reputation with them. If, for the clinical branch people, when they go to the OPD, see what your teachers, how your teachers are seeing the patient, how they are treating the patient. Try to grasp as much as you can. I won't say that all the institutes, in all the institutes, the teaching is same, in all the institutes, the patient workload is same, but finally, one thing is very sure: the degree what you are going to get is same, and nowhere in your degree your institute name will be mentioned. So the final degree will be same. Now it's only your hard work, your dedication, and your sincerity that will make you a very good specialist. So in whole of your 3 years, be dedicated. What if you have got? Don't. Sometimes I find in my group, group is going on that is in the name of ADD. This is an association, very good association of Diplomate of National Board Doctors, which is always trying to help all the DNB candidates and those who have passed out. So they are always helping, and we will be pleased to help you if you have got any such difficulty in your institute level or at the level of NB. We'll try to help you. Now, your dedication and sincerity should be there. For the clinical branch, the case presentation is one of the very important very important thing that you have to do, and by case presentation you will have more and more knowledge on your topic, and it will be easy for you to pass your exam. So always be in a front line, always be in a front row. I generally find the people are very shy in nature. They are very less confident, and they have got very difficulty in speaking, and they don't try to present the cases. They ask their friends and all, they push their friend or all in front to present the case, and they stand behind them. Don't do this thing. Always try to present the case. Might be in the first few cases you will won't be able to present it nicely. Might be you won't be able to finish it off nicely, but keep on presenting the case. The presentation will help you in passing your DNB practicals in a very first attempt. So another important thing is, during your DNB course, for the theory preparation, you have to study. Every clinical branch have got some specified books, from basic books. Purchase those books, and along with reading your subject, you try to solve the last 10 years question paper. That is very easily available for either NBE or it is available on the website. Take this question paper, divide it in the systems, and make notes of it. I will show. I have prepared notes. Now this is a very old story. I passed it a long time back. Now I have prepared notes, and in this I've got notes. I've read notes really of all the questions that have appeared in the last 10 to 15 years. And before exam, only this book used to be in my hand, and that helped me a lot in that passing my theory exam. And I can assure you, if you have last 10 to 15 years notes, you can never fail in your theory examination. So during the course, after you have submitted your protocol, now the thing is, you should work on sincerely on your thesis. Your thesis have to be submitted 6 months before your date of appearing for the final examination. So if you are eligible to appear in the December session, so by 30th June you should submit your thesis. If you are eligible to appear in the June session, so by 31st December you have to submit your that thesis. Then might be that your thesis will be sent back to you for some modification. Don't worry, modify it nicely as per the requirements of the NBE, and you can submit. Because this thesis thing, this disturbs a lot during your whole course. So try to finish it off as early as possible. Don't linger, because if you have not submitted your thesis in time, might be you will be debarred to appear prepare for your final examination, that will waste your that will unnecessarily waste your time. So make sure that you have completed your thesis in time. The few candidates always wanted to know about the stipend, they wanted to know about the leave rules. So stipends, the National Board of Examination have fixed the minimum stipend for the DNB candidates, that in the first year 35,000, second year 37,000, and third year 39,000. And so this is for the board specialty. For super specialty it is a bit higher, and an increment of 2 years is there. So this is the minimum stipend that you will get if you join DNB in any institute. But rest is, if the institute want to give more stipend to you, they are free to give more stipend. But this is the minimum stipend that has to be given by any National Board of Examination institute. Now the fee structure is also available. It is around 1.25 lakhs including accommodation per year you have to pay if you have joined any of the DNB institute. This is the fee structure. About the leave, you will be given a 30 days paid leave in a year, and beside that there is a facility of maternity leave and the paternity leave that you can avail as per the leave rule guidelines issued by the National Board of Examination. So these all things you have to do during your course. Now you will be having your case discussion, you will be having your journal club, you will be having your faculty discussion, you will be having your thesis discussion, you will be having your case presentation, seminars. All these things will go along with your course. You concentrate on this and try to participate in more and more number of these case presentation or journal clubs and all. And this will increase your speaking power, this will increase your confidence. You will be you will have more faith in you. The best thing is that you should have faith in you. If you are very good in your subject, you will have faith in you. Then after you complete your DNB 3 years course, you will be appearing for your theory examination and practical examination. So now, as told, this is one of the most difficult examinations to pass. So you have to the input that is required to pass is much more higher than what is required in the MD/MS. And people generally say the entry in MD/MS is difficult, but exit is easy. And on the opposite, the entry in DNB is easier, but the exit is very, very difficult. So you have to prepare yourself in the same way that you can clear your practical examination in first time, because more years you will take, it will waste your time. Telling my own story, I was not able to clear my DNB in the first 2 years, and it's a great irony. When I was very good at surgery, very good at academics, I could not clear my examination. But when I was away from the surgery, I didn't have the surgical hands, I didn't have the academic test, no case presentations and all, nothing was there. But it was my self dedication that I have to clear my examination. I came back, I fight back. For theory, I have already prepared the notes, so I never find difficulty in passing my theory examination. I had to give few attempts for the practical examination. So to prepare for a practical examination, lot of videos are available for the case presentation. These are available on the YouTube or so many channels. You take out these videos, go through the videos, and try to present the case as there is fixed protocol for the case presentation. So if you have that fixed protocol in your mind, definitely you are going to pass. Then during the case presentation, the examiner just wanted to know what basic thing you know, and don't try to give a very rare diagnosis, and be focused on your subject, be focused on your patient, and there is fixed protocol to present the case. You should have that protocol in your mind. That can only be achieved if you present the case a number of times. If you have already left your institute, you can present in front of camera, in front of mirror, and try to see that how confident you look when you are presenting the case. Try to present your case to your friends if your friends are available with you, and try to, if no friends are available, doesn't matter, try to present it in front of mirror and make yourself confident, and I assure you that you will definitely definitely pass your national board of exams examination in the very first few attempt or very first attempt. Nowadays results are improving. Earlier the result used to be very less, say 50 to 20%, but now it has gone to around 50 to 60% in the theory, then again 50 to 60% in the practicals. So now the results are bit improving. It doesn't matter if you, even if you have passed the DNB, you have taken few years, it's your confidence, it's your knowledge, it's your the way you handle your patient matters when you are in the practice. Nobody will ask you about the degree, nobody will ask you about your institute, nobody asks you what you have done in the whole 3 years. It only matters that how knowledgeable you are about your subject and how good you can treat your patient, how good is your hand while treating your patient. That's only matters. So I wish all of you a very good luck and hope my video will help you and motivate you to go through your DNB journey very successfully and pass your exam in the very first attempt. I wish all of you a very good luck. Thanks a lot. Thank you very much.